STEM 15 will be looking at what role do healthcare facilities and services play in achieving better health for all Australians. In particular, we're going to be looking at the healthcare in Australia. For the purpose of this video, this STEM will be broken up into two parts. This video will be covering the range and types of health facilities and services, responsibility for health facilities and services, and the equity of access to health facilities and services. The remaining 3 dot points will be covered in part 2 of this video. What we have here is a mind map showing the range and types of health facilities and services that are available in Australia. And as it says, they can be classified into 2 different areas. There is either institutional facilities and services or non-institutional facilities and services. So there are 2 different areas straight away, institutional or non-institutional. Under institutional, we have things such as nursing homes, hospitals, and psychiatric hospitals. Under non-institutional, we have medical services, pharmaceuticals, and health-related services. Our institutional facilities and services comprise of the following. Number 1, hospitals. And again, these are general and specialised healthcare. A patient in a hospital can be classified as either a public or a private according to their choice of service. Public hospitals are operated and financed by the government and the healthcare service is free, whereas a private hospital, they are owned and operated by individuals and community groups. The service must be paid for by the patient, although Medicare and private health insurance refund most of the expense, and they also get to have their own choice of doctor. Number 2 is nursing homes, which provide care and long-term nursing attention to those who are unable to look after themselves, such as the elderly, people that might be chronically ill, or people with a disability. The federal government is able to fund this through some of our taxes. The third area is psychiatric hospitals. These hospitals provide treatment for people with severe mental disorders. They use a system of care that integrates hospital services in community settings. So there are 3 institutional facilities and services: hospitals, nursing homes, and psychiatric hospitals. The non-institutional facilities and services have the following 3 areas: medical services, health-related services, and pharmaceuticals. So remembering that these are the non-institutional. Number 1, medical services. These are some of the services that are provided by doctors, specialists, and other health professionals. When you get sick, you go and see your doctor or your local GP, which in other words is your general practitioner, and this is the most commonly used service. However, some of the consultation rates have increased. Medicare refunds patients' payments for these services. And specialists such as obstetricians, dermatologists, orthopaedic surgeons, and others who have an expertise in a certain field of medicine are also used. The second area for the non-institutional facilities and services is health-related services, and these include some of the other areas such as dentistry, optometry, nursing, ambulance services, and physiotherapy. The final area for non-institutional is pharmaceuticals, and this is more talking about some of the products or the drugs that are supplied through prescription from doctors or hospitals or over the counter. So if you go to a doctor and he writes on a bit of paper for something that you need to go and purchase, that's known as a prescription drug, as opposed to going into a chemist and being able to buy something without a prescription. They're known as over-the-counter drugs. The Pharmaceutical Benefit Scheme was also subsidised by the federal government for people with special needs to allow them to purchase some of the drugs that they require, so they're not out of pocket. The second area of the dot point for this one is looking at the responsibility for health facilities and services. And we can see here that there are 5 groups that are responsible for a range of health facilities and services within Australia. There's the federal government, the state or territory government, local government, private sector, and community groups. First area we're going to look at is the federal government. The first thing to notice here about the federal government is that they have very little direct responsibility for the delivery of health services. The only thing they really concentrate on here is reparation hospitals, which are other words known as the war veterans hospitals that they go to when they come back from war. The main role of the Commonwealth Government is to provide funding to the state and territory governments for them to deliver the appropriate health service to their population. So the allocation of money comes from the federal government. The Commonwealth Government has also expanded its role recently and looked after things and taken control of Medicare, which is very, very important, and Pharmaceutical Benefit Scheme, as well as some of the more health promotional initiatives such as mental health, alcohol, and HIV/AIDS, the really important ones, the ones that are very, very high on our rates at present. The Commonwealth Government shares with the states the responsibility for occupational health and safety, and also manages WorkSafe. But remember, the main role for the federal government is the allocation of funding to the state and territory governments, which we'll look at now. The state or territory governments, their responsibility is providing funding for health and community services such as public hospitals, medical practitioners and family health services lies within the state or territory. They also develop the legislation and regulations, so the laws, the rules under which private hospitals, nursing homes and health professionals are able to operate. The state and territory governments also manage some of the mental health programs, dental health services, home and community care, family health services and rehabilitation programs. So they've got a bit more of a hands-on role. They implement the rules, the regulations, they look after our hospitals and some of our mental health programs and nursing home areas as well. The local government. At a local level, governments are responsible for implementing state health policies, so policies that direct just in the area they're in, and controlling local environmental issues such as maintenance of recreational fields. So all of our sporting facilities, the local government is responsible for that, and that's where the funding comes from the federal government to allocate people to work at these areas. They're also responsible for providing a wide range of personal, preventative and home care services such as waste disposal and Meals on Wheels. And there's a link to our STEM 15 on PM Online where you can have a look at Meals on Wheels and how it operates. The private sector. The private sector is responsible for providing a wide range of services such as private hospitals, which we saw earlier on, and alternative health services including some dental, physiotherapy and chiropractic services. These services are usually privately owned, funded and operated through business, charity or religious groups such as Main Health. However, some private sector services receive government funding, such as the New South Wales Cancer Council, to allow them to perform the activities and the information that they show to the community. Community groups is the last area. On a community level, these groups are responsible for promoting health within a more concentrated or focused area of health. For example, the Asthma Foundation and Diabetes Australia, they're going to be promoting information about both asthma and also diabetes within the local community groups, implementing more work with schools and those areas. So there's a bit more ground level and getting closer to the people that might need this sort of help. Third area of this doc point is looking at the equity of access to health facilities and services. When we talk about equity of access, we're talking about everybody in Australia having a fair or having an honest opportunity to be able to use these facilities and services. The cornerstone of Australia's healthcare system is Medicare. And again, there's some information on Medicare to help students with their understanding of how Medicare operates on PM Online under STEM 15. But when we can link Medicare to equity of access to health facilities and service by the whole idea being that Medicare was designed to allow simple and equitable access to all Australian citizens regardless of their location and SES. So that's why Medicare was introduced. Some supporting programs such as the Medicare Safety Net and Pharmaceutical Benefit Scheme promote equity of access. The equity of access, allowing everybody to have equal share, was the whole intention. However, some individuals and groups continue to find it difficult to access appropriate health facilities and services, again based on where they live or maybe their level of income. Medicare does not fully cover or provide access to a range of medical services that are vital for maintaining good health. So people with a low level of SES, they will not be able to use these facilities or services, even though they may need them because they don't have the funding to be able to pay for them. And as it says here, this places people of low SES status at a disadvantage. So straight away we're starting to see some concerns about our equity of access. Can't see it happening everywhere. General dental services, speech therapy, physiotherapy and some optometrical services are examples of healthcare services that for many might not be accessible due to financial constraints. So even though the child or the family member requires these services, because of their low SES, they're unable to access this service, showing again that there is not really equity. To continue on with our equity of access to health facilities and services, it's also been hampered in recent years by the overcrowding and lack of beds available in the public hospital. At a private hospital, people who have private health insurance, they can then go, they can select their doctor and the hospital that they want, and there's no real waiting time. They can go straight in. But in the public service, where a lot of people are going, there is an overcrowding because people don't have private health insurance, and as a result, there is a lack of beds. So it means people are waiting a very, very long time to have simple operations. Access can also be difficult for people living in rural or remote areas. People who live out in the country, for example, they're not going to have health facilities and services at their doorstep. They might be 50, 60, 100 kilometres away from the nearest medical centre. The poorer health status of Indigenous people and other Australians living in rural and remote areas supports this notion. Aboriginal people or people living in rural areas, again as we mentioned before, don't have the access to the facilities and services, So therefore, they're not really promoting equity within all these facilities and services. And the last one here says, people from non-English speaking backgrounds in different cultures might also not take full advantage of the services available to them for a number of reasons. One may be they don't understand the language. They can't read the signs or the information to understand how to use it. They may again be a lower SES because of their culture, their language they speak. They might not be able to get the job that they require, therefore having a lower income, unable to survive using some of these facilities. So these are a number of points that are just starting to show some of the problems we've got with equity of access to health facilities and services. The main thing being people living in rural areas, people of low SES, people of different cultures who may not have the same, or the language barrier might be a concern, or even some of our Aboriginal or Torres Strait Islander people who don't really use these facilities to the best of their advantage.